You're watching the Power Hour
The Power.
with DJ Larry Jones.
What are some of the blame? All right, it's time for the Power Hour, and on this segment, I have. All right, you're watching Mental Health Moments. All right, you know what time it is? It's time for the Power Hour going home. So I had to find out more, and all right, you know what time it is? It's time for the Power Hour, and what is a toxic substance, and how does it affect human health? My next guest is here to tell us all about that. You might want to stick around. Ladies and gentlemen, please welcome Dr. Natalie Rose. Natalie, how are you? Well, doctor, how are you?
Very good. Thank you so much for having me today.
Oh, it's my pleasure. I had to have you on the show when I came across your social media and I saw that toxic substance.
Yes.
It piqued my curiosity, and I was very interested and intrigued on hearing more. Now, what is a toxic substance?
So it can span so many different areas, from environmental toxins, like just even like pesticides, herbicides that are used, or weed killers that are used that make their way into our food supply. It can span personal health care, personal care items like your hair care, body care, or cosmetics in women. And it can also span even prescription medications. There's a high level of metals that are used in prescription medications that can be used in also that are found in like refined powders, like our protein powders. Our soil has a lot of metal toxicity in it. Oceans have a lot of it in it. So if you're getting products that come from the sea, you can get a lot of heavy metal exposure that way. It can also span just from organic pollutants that we breathe daily. And what else? It can also, let's see, and also like our cookware that use a lot of like non-stick
Right.
PFOAs and Teflon. So and it's just important to notice that all of these, we can be getting constant exposure on the daily, and they can bioaccumulate in the body. So that's basically what I study. It's in functional medicine, is the bioaccumulation of these toxins that can, if we're not eliminating them fast enough, they can cause symptoms in individuals. So,
Right. Now, what are some of the common routes of exposure?
So routes of exposure, it daily practices. So just from even what we're applying on daily, what we're cooking on. So everything, even what main source will be from our food supply. Even the water bottles that we're drinking, if we're getting, plastic water bottles, you can get BPA exposure. Every year, there's 2,000 new chemicals that they produce, and it can take 10 to 20 years for them to even let us know if something is toxic. So we're coming out with, every year it's a new exposure of different chemicals, and it's just, it can vary from individual to individual on how it can affect a person.
Right. Now, how can we protect ourselves from it? I mean, it seems like it's everywhere.
Right. So just raising awareness. One website that I love to mention to a lot of my clients or followers is ewg.org. That's a website that you could just go on. If there's any products that you're concerned, whether they're cancer risk or high, chemical risk, it'll tell you the grade at what they are at, so you can raise awareness that way. You can eating just a diet full of whole foods as opposed to packaged ingredients that are high in like high fructose corn syrup, because it's shown that if you're getting a high sugar, low protein diet, you're more susceptible to these toxins and how they can be poorly eliminated. So the point is to help detoxify and biotransform these toxicants. So just by aiding that, you can have a less risk of an effect, of a health effect, if you basically promote their elimination. And another way is going to be, let's see, what else did I have? And so gut health is another huge topic to discuss, because when we don't have a good flora in our body, then we can have a lot of leakiness that can occur. So when we're ingesting some of these toxins, if we don't have a good gut barrier, they can leak into our bloodstream,
Mm.
stimulate inflammation, stimulate disease prognosis, progression. So just having great gut health, eating probiotic rich foods, getting foods that green leafy vegetables that are high in sulforaphane that can help with elimination. So honestly, reducing exposure and then helping elimination is going to be the best bet in order to not be affected by these
Right.
exposures.
Right. Now, what advice would you give someone who may be concerned about their potential, exposure?
Yes, if they feel and one of the main side effect to these things, they're also titled as obesogens. So what they can do to a person, they can increase their leptin resistance, so they can cause weight gain without an individual consuming high food. So as we get older and we're not detoxifying as well, just because of our pathways being hindered and all that, we can start accumulating body fat because that's where they like to store. So they like to store. So if an individual is feeling symptoms like weight gain, and just it can also hinder your thinking, your cognition, if they're feeling symptoms like that and they're not feeling like they're getting the right treatment plan for it, I would highly suggest like reaching out to a functional medicine practitioner. There's lots of specialty tests that can help test whether you have high accumulation of any of these toxicants in your body, and you can get different type of treatment if you feel like you're not getting you're not seeing a difference, if you're going leaning more in terms of a conventional route of treatment.
Okay. Now, I want to change gears for just a minute. Okay.
Sure.
And I would love to have you back on the show to elaborate on what I'm
Oh,
getting
I
ready
would
to say.
be more than happy to.
Now, healing disease by addressing the root factor. Let's talk about that a little bit. Give us an example of what it means.
Sure.
Uh,
Sure. So basically, okay, so here's functional medicine. Functional medicine, by looking at root factors, we're not treating. So if an individual comes to me and is saying, I have lack of cognition, I can't think straight, I'm having anxiety, in conventional medicine, we're going to treat that like, okay, maybe possibly give this person an antidepressant.
mhm.
Maybe there's possible dementia going on. A lot of the times it's like, let's follow along and let's see how this goes. It's almost like a waiting game until you can fully diagnose the person. In functional medicine, we already know, like, if I'm getting a person explaining to me symptoms like that, then I'm thinking of a great gut brain axis that we can work on. There's definitely a lot of work and healing that we can do on the gut that can help alleviate that anxiety and help to reduce and strengthen their cognition. It can also do a lot with like liver that is congested and showing signs of that. You can also see a lot of allergy symptoms that can present in an individual when I know the gut is hindered. So it's looking beyond just the symptom and treating the symptom like a band-aid. It's also looking and knowing where that we can treat to help prevent some of the symptoms. And a lot of the times getting a full history on a patient, from just even how you can even their birthing process and how they were fed and what type of foods that they were giving, how much antibiotic exposure they've had. You can learn a lot from a patient that way as well. So getting to the root is also getting history, getting what exposures, how long that patient, and finding out exactly when their symptoms started manifesting. So when I know those symptoms, when they started, you can put a timeline together. And it's not just coming to me and treating, okay, this is a symptom and that's what we're doing. It's going back and trying to find out where the root factors started from.
Right. And, it's so much I want to ask you about this, but we're going to save it for part 2.
Sure.
And so I know you have some things to do on your end. You're a very busy woman. And I do want to thank you for joining me on the show today,
Of course. It
Dr.
was my
Natalie
pleasure.
Rose. My
Thank you
pleasure
so
having
much,
you
and
on.
thank you for your interest in this subject. If anything, it's about raising awareness on this topic that I'm very, very passionate about. And I know many people just feel lost when it comes to and need just some guidance. So just knowing that they're validated and it's a different time we're living in. So raising awareness is key to
Right.
helping everyone. This
Absolutely. I totally agree. And I definitely do really want to have you back on to talk about the, you know,
I'll be
healing.
more than happy to.
Yeah, definitely. So we have to schedule that. Ladies and
Okay.
gentlemen, Dr. Natalie Rose.
Thank you.
You're watching the Power Hour. The Power. With DJ Larry Jones.
What are some of the blend? All right, it's time for the Power Hour. And on this segment, I have. All right, you're watching Mental Health Moments. All right, you know what time it is. It's time for the Power Hour going home. So I had to find out more, and